Hi everyone, thanks for joining. We're going to get started now. Today we have approximately 30 minutes, one question, one follow-up. We have Dr. Moore here today, so we'll turn it over to him for some brief remarks.
Good afternoon, everyone. Bon après-midi à tous. Today, there are 495 new cases of COVID-19 in Ontario. There are 292 people in hospital and 172 in the intensive care unit due to COVID-related illness. I'm sorry to say another 8 deaths have been reported in Ontario. Our vaccination rates continue to rise. Currently, 86.1% of eligible Ontarians have had 1 dose and 80.7% have had 2 doses of a COVID-19 vaccine. We are moving closer to our target of 90% of eligible Ontarians vaccinated, which will help us slow the transmission of the Delta variant. A total of 36,404 tests were processed yesterday with a positivity rate of 1.7%. We need to remain vigilant and cautious so we can keep our schools and our economy open and effectively control outbreaks when they occur. For schools, it's been 3 weeks since most educators, staff, and students across the province returned to the classroom to resume in-person learning. Getting our children back in schools is thanks to the collective commitment as a province to get vaccinated and to consistently follow the public health measures that are in place. We continue to monitor the situation very closely, and our schools continue to be safe places to learn. The protective measures that we put in place, including daily screening and robust case and contact management, are working. While there have been 2,042 COVID-19 cases identified amongst the age group of students and staff who attend school in person, these cases continue to reflect what is happening in the community setting. In-school transmission has been minimal and well contained. Bien que 2042 cas de COVID-19 aient été recensés parmi les élèves et le personnel qui fréquente l'école en personne, ces cas sont toujours un reflet de ce qui se produit dans nos communautés. La transmission à l'école est minime et reste maîtrisée. To date, for the 2021-22 school year, there have been 153 outbreaks, and 115, or 75%, have been 3 or fewer cases. This is remarkable in the face of Delta, which typically wants to spread from 1 to at least 7 other individuals. This is thanks to the communities following the public health measures and staying home when they are sick, as well as rapid response from our school boards and public health units. We prepared for this and have taken the precautions and actions necessary to ensure schools remain open for the entire year. If we see increased transmission in schools, we have the means to address it. We are continuously reviewing the health and safety measures in place for schools and will add or enhance measures that are proportionate to the risk while minimizing disruption for staff, students, and families. In regards to the proof of vaccination requirements, it's been a week since the proof of vaccination requirements for patrons to enter certain settings came into effect in Ontario. And I want to thank all Ontarians and Ontario businesses for their patience and their support. There have been and will be growing pains for any new program, but we will help ensure that the very businesses that will require proof of vaccination are able to stay open and stay safe, both for their customers and their workers. It's important to remember that proof of vaccination requirements help to increased vaccination uptake while also mitigating COVID-19 transmission to protect and save lives. They will also help mitigate the likelihood of future restrictions. Il ne faut pas oublier que les exigences concernant la preuve de vaccination sont un incitatif pour améliorer la prise de vaccin tout en atténuant la transmission de la COVID-19 dans le but de protéger et sauver des vies. Ces exigences permettront également de mitiger la probabilité de futures restrictions. Our plan has always been a slow and steady reopening of the province that can be sustained, and proof of vaccination requirements are one tool we can use to ensure this remains the case. We have seen positive trends continue over the past week, both for first and second dose vaccine uptake. So thank you to everyone for having proof of vaccination at the ready. Thank you to the businesses for having diligence for checking that those entering and going inside your establishments are vaccinated. And thank those who have recently made the choice to get vaccinated. Collectively, we are making our communities safer. Next topic is for Pfizer recommendations under 25. As we continue to push for our vaccination rates to increase, we have made the decision to issue a preferential recommendation for the use of the Pfizer vaccine for individuals aged 18 to 24 years of age. This decision was made out of an abundance of caution due to a very small but observed increase of pericarditis or myocarditis following vaccination with Moderna as compared to the Pfizer vaccine in this age group, particularly amongst males. Alors que nous poursuivons notre poussée pour hausser nos taux de vaccination, nous avons pris la décision de recommander de préférence l'utilisation de vaccins Pfizer pour les personnes âgées de 18 à 24 ans. Cette décision a été prise par excès de prudence à cause d'une augmentation faible, mais quand même observée de péricardite, myocardite, suite à la vaccination avec Moderna par rapport à Pfizer chez cette groupe, particulièrement pour les jeunes hommes. While we are making this recommendation, it is important to note that myocarditis, pericarditis following COVID mRNA vaccines remains a rare adverse event following immunization, even amongst the age groups with the highest observed rates. The majority of reported cases have been mild, with individuals recovering quickly, normally with anti-inflammatory medication such as ibuprofen. The risks of myocarditis and additional serious adverse events, including pericarditis, arrhythmia or abnormal heartbeat, deep vein thrombosis, so clots in the leg, or pulmonary embolism, myocardial infarction, intracranial hemorrhage, and low platelet counts is in fact 18 times higher from a naturally occurring COVID-19 infection alone. I know that this news may make some people nervous and heighten concerns about receiving a COVID vaccine, and I can understand that. But the benefits of vaccination continue to significantly outweigh the risks of COVID-19 illness and related, possibly severe consequences. Vaccines are safe, they are effective at protecting us, and have significantly reduced the risk of infection, hospitalization, and the use of the intensive care units in Ontario alone. They continue to be the best way to protect our young adults, their families, and our communities from COVID-19. In short, we are doing well, Ontario. We must stay the course. I am extremely proud and thankful for your continued efforts in mitigating the spread of COVID-19 in Ontario. Thanks to you, we are managing to keep the fourth wave under control. Je suis à la fois extrêmement fier et reconnaissant de vos efforts soutenus pour atténuer la propagation de la COVID-19 en Ontario. Grâce à vous, nous arrivons à garder le contrôle de la quatrième vague. I am very aware of the impacts of the COVID-19 pandemic and what it's had on our businesses, our livelihoods across the province. But following the measures we have in place, along with your continued patience with the proof of vaccination system, it will help us ensure that we keep our businesses open, best protect Ontarians by mitigating the spread as we head into the colder months of fall and winter. Thank you. Merci.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
From Laura Stone at the Globe and Mail. Hi, Dr. Moore. Thanks for taking our questions. I wanted to first ask about schools and rapid tests. You said in your opening remarks, we need to remain vigilant and cautious to control outbreaks. So why is the government ordering agencies to stop supplying these rapid tests to parents and community groups so that they can organize their own surveillance testing programs for schools?
Thank you very much, Laura. So I do believe the PASS program was intended for businesses in Ontario, and its application in the school system wasn't following the rules used by that program. I want to assure Ontarians we are reviewing asymptomatic testing and its possible application to schools across Ontario, especially in high-risk settings where there's been previous outbreaks or where there's high risk of community spread. And we are reviewing the best means of implementing an asymptomatic testing strategy for our schools. We're reviewing best evidence across the globe and ensuring that we adhere to those as we go through this pandemic. And asymptomatic testing is one strategy, but it'll be risk-based. And I hope the parents can understand that our schools are remaining safe. We've got excellent protocols in place, and that the addition of testing strategy, asymptomatic testing strategy, will only further build confidence and support our school system. So that's absolutely being addressed, and stay tuned as we make further announcements on this subject.
Follow-up?
Well, Dr. Moore, why are businesses being prioritized over schools? Ontario schools have been closed longer than any other province. So why aren't you doing everything you can to keep them open? If this is another useful tool for businesses, why are you not using them for schools? There's millions of tests just sitting there. What's the justification for this?
Number one, the program was for businesses and businesses alone, so that program has strict eligibility criteria. And number two, we are addressing asymptomatic testing in schools. Our current testing strategy, which uses a PCR strategy for outbreak management, is responsive, is excellent, is in play, and I'm very happy with our ability to limit outbreaks in the school setting at present. The numbers to be able to limit outbreaks in school settings to 4 or less, I think, is brilliant in these cohorts, given the high transmissibility level of Delta. And I'm happy with that strategy to date. I think if you compare us to any other province, we're keeping our schools open, we're keeping our schools safe, we're minimizing the disruption in schools, and we will build an asymptomatic testing strategy for test and stay, and or surveillance strategy for schools that are having issues or high-risk communities. So that is in play. It will be put in play. And I want to assure parents, we have a good track record at present. We keep our kids safe by keeping our community safe and embracing high levels of community vaccination. So some of our communities in Ontario now have vaccination rates of eligible adults of around 94%. Some of our large metropolitan areas are approaching 90%. I'm so proud of this last mile strategy and the work that our health units are doing, because as we protect adults, we protect our children. I'm also happy that the teachers, the workers in the school environment are coming forward, both getting vaccinated, and if they haven't been vaccinated, they're also getting tested. As of the 27th, it's formalized that they'll get tested at least twice a week to further protect our children, and they're following all the measures of infection prevention and control with masking and shields if they're within a 2-meter distance. So all of those protocols are working, and we will always apply best evidence in our school setting, including an asymptomatic testing strategy for high-risk environments.
Next question.
From Jack Howen at Queen's Park Briefing.
Hi, Dr. Moore. I was wondering if I could get your take on Toronto's request to be exempted from drug laws regarding possession.
I hadn't heard of that as of yet. We're certainly reviewing all policy options that can help protect those that use drugs, that ensure that they are provided with access to services. I do believe that the police have decreased the amount of fines and or criminal application to those that use drugs across Ontario. And to me, that's a good step. and we will further need tools like this to evaluate them, to put them in play in Ontario to help protect those that use drugs and ensure that they're offered both treatment and or alternates like opiate agonist therapies and or access to rapid access addiction medicine clinics. And those targeted approach, I think, are very important and essential across Ontario.
Follow
Thanks.
up?
And thanks. I should have been more clear. It was a request from the federal government. But on another topic, I wanted to ask about COVID misinformation. You addressed it briefly here with the recommended switch to Pfizer. But I'm just wondering if, in your opinion, it's time for the province to go a bit more on the offensive now that we're seeing larger, more widespread, sometimes more aggressive anti-vax protests. And in some cases, we're seeing doctors allegedly spreading COVID misinformation. Obviously, we've just seen Patrick Phillips, but we don't know how many more there might be. So I just wanted to get your take on that as well.
Well, thank you for that. I do think it's an issue, but the numbers speak for themselves as well. So 86%, over 86% of Ontarians have stepped up and been immunized. And to me, that's a wonderful number. It's one of the highest in the world. There are provinces ahead of us, so I'd love us to be higher. And I do believe that the highest attainable number we can get will help protect us all as we head into the winter and help protect our mental, physical, social, and economic well-being. So it is working. There will be a vocal minority, as there is for any major topic area, whether it's Wi-Fi, 5G, wind turbines. There's always a small and vocal minority that wants to have their voice heard. And in a democracy, that is enabled and appropriate. But the silent majority are coming forward and getting immunized. As well, for physicians, I'm happy that the College of Physicians and Surgeons of Ontario is taking action against physicians that are providing misinformation. There are over 33,000 physicians, and to have just a handful speak against immunization and or public health measures is an absolute minority. Last time I've heard the data, over 96% of physicians have come forward and had their first and or second doses and are embracing immunization and prevention strategies in their practices. So we are often inundated with a voice of a loud minority, but I am confident that the silent majority is coming forward in protecting our communities day in and day out.
Next question.
From Randy Rath at CHCH TV.
Yeah, hi, doctor. I'm wondering, NACI has said that residents of long-term care homes should be given a third dose immediately because of waning immunity over time, particularly among the elderly. Is that happening in Ontario?
Yeah, so we reviewed that data. We were following the American equivalent who embraced that around a month ago. We reviewed Ontario data and had our expert panel review it, and we've put that in play roughly around a month ago. I'm happy to report we have a target of October 8th to have the highest percentage of residents of long-term care facilities embrace this third dose. We're well over 50% on our way to having that adopted by clients, patients of the long-term care sectors. I do think that will further minimize harm in that vulnerable population in the fall and winter. And as you know, the Minister of Long-Term Care has embraced immunization policies for workers and or testing for workers as another measure to protect those patients. We'll continue to monitor this situation. I have seen a rise in the number of outbreaks in long-term care facilities slowly over the last several weeks, which is raising concern, and we're trying to ascertain the cause of those, whether it's related to any lapse in infection prevention and control, or whether it's associated with non-vaccinated visitors or staff, and are trying our best to limit the harmful effects of this virus in that vulnerable population. So far, we've been able to minimize the negative impacts, but to see that trend going up now has me worried, and we'll be reviewing that with the Ministry of Long-Term Care on a regular basis and our local public health agencies.
Follow-up.
Another question on a different subject. Thanksgiving is coming at us very quickly. I'm wondering what people should do about unvaccinated friends and family. Should people exclude the unvaccinated from their indoor celebrations? Should they not invite people that are not vaccinated to their homes? Or what do you think about that?
Well, these are individual decisions by families, and I'm sure there'll be active discussions in the planning phase, so it's a great question now. The general principles would be, as you go indoors, anyone should be screened for any active symptoms of COVID-19 or whether they're a high-risk contact of any individual. They shouldn't be attending a celebration if that's the case. If there's mixing of immunized and non-immunized, I think basic symptom screening, masking would be appropriate. In a fully vaccinated family, obviously you don't have to wear your mask. You could check for symptoms, ensure that no one is symptomatic attending a family dinner. Especially, I get concerned when it's multi-generational or whether there is anyone immune suppressed or compromised attending a family dinner, to be especially careful for those individuals. But the basic tenets of, I think it's fair to ask the question if you've been vaccinated or not, to also ensure that you do a risk assessment on anyone that's vulnerable that's attending that could have an adverse outcome if they get infected with COVID-19 as well. Outdoors always trumps indoors. If the weather's fair, it's always nicer if it's a mixed population of vaccinated or non-vaccinated to have the occasion outdoors where we know the fresh air is safer than going in an indoor confined space where we're closer. So those are some of the basic principles. We'll be releasing our recommendations. It's 2 pages of recommendations for families to be able to review going forward. But thanks for that early question. We're preparing a response that will be public very soon.
Next question.
From Holly Mackenzie-Suter at the Canadian Press.
Hi, I'm wondering about the myocarditis recommendation about the Pfizer vaccines. We understand that fears over myocarditis risk from the vaccination has already been a really big source of hesitancy and anxiety for people who aren't getting the shot. So I'm just wondering how worried you are that this advice might put people off permanently, and if you're doing anything in particular in terms of outreach to address people's fears and avoid that.
Thank you so much for that question. I did have concerns of addressing this, but the ethical principles that I had maintained was, number one, I have to build trust with the public. We have to have accountability to the public, and I think the public deserves to know the facts on the risks that we've identified in Ontario. I do believe we have a very robust adverse event following immunization surveillance system. I also am informed by expert groups, so the Children's Immunization Table, the Science Table, and Public Health Ontario, as well as our Immunization Task Force. All of those groups recommended to me that we maintain those principles and inform the public of this increased risk of a very rare event. And I hope that the public will realize we're trying to be as transparent as possible. These data are now published on the Public Health Ontario website, and even though it's a very rare risk that has not shown any serious complications, in that most of the time these symptoms resolve with an anti-inflammatory like ibuprofen or naproxen, and of the very small number of people that have had to be admitted to the intensive care unit, most of the time that's for investigation, so taking a blood test, a cardiogram, or an ultrasound, and then they've been rapidly discharged homes. And I just want to be clear, we've had no fatalities whatsoever associated with this complication related to this rare side effect of the vaccine. It is with those principles that I have come forward. It was eventually my decision to make, and I hope the public will see that we've got a robust system, that they should have trust in it, that will be transparent, and that I'm not holding any facts back. There is a risk. It's increased between one product and another. And as a result, for those specific age groups from 18 to 24, we're making a preference that individuals be offered the Pfizer over the Moderna product. And also in transparency, I have 3 young boys, 2 of whom are in the 20 to 24-year-old age group, and they both received Moderna. I had no concerns about them having that product. Moderna is an excellent product. It's got very good immune uptake, and it's got very good prolonged immune response and protection, and I have complete confidence in it. But we must be accountable, transparent, and I hope the public see that as our main means of building trust in the vaccine delivery system.
Follow-up?
Yeah, and as a follow-up, I'm asking about the planning for vaccinating kids aged 5 to 11, just because we're expecting that approval to come pretty soon. Like, what's the province's guidance to health units going to look like specifically, if you have any information on what's being planned, like more clinics in schools or something like that? And also wondering if you can give us an update on whether we're going to add COVID shots to the Immunization of School Pupils Act.
So we still haven't received data on when the formal information will be submitted to Health Canada. We do anticipate, and it'll be the next couple of weeks, that Health Canada will have a chance to review the safety and the effectiveness of the vaccine. This will be the Pfizer application, I think, will be coming first for those age groups. To also be clear, it's a pediatric dose. So the normal adult dose is around 30 micrograms. The pediatric dose is 10 micrograms, so it's a third. And the risk of myocarditis, pericarditis, from the specialists that I've spoken to, it typically increases after puberty. So we don't anticipate that the 5 to 11 will have a high risk for that very rare side effect of myocarditis, pericarditis. But we're certainly going to be looking for it in the data to be able to inform parents of any rare side effect or complication of the vaccine. In terms of the ISPA, the Immunization Student Pupils Act, I think it's important to be clear. That act mandates for certain antigens like measles, mumps, rubella that you must report whether you've been immunized. If you haven't been immunized, you can get your child hasn't been immunized, you can get an exemption for conscientious reasons and or religious beliefs. But it doesn't mandate vaccination. So that may be a fallacy to some individuals. It just ensures that you report your vaccine status to public health. So what we've done is, in partnership with the Information Privacy Commissioner, is that we've allowed the data that has the immunization information in the COVAX reporting tool to be shared with public health to ensure that they're aware if there's an outbreak in a school setting of who's been immunized and who isn't. And that information is now building in the hands of public health, given that the school lists have been finalized this last several weeks. And that will prepare public health for any outbreaks in those settings. So there's a difference between reporting through ISPA and a mandate to be immunized. The ISPA does not mandate immunization. I would be hesitant until we get further information on safety and effectiveness to ever mandate the vaccine. We know in phase 3 trials we get a certain amount of information, but even in the phase 3 trials of the major vaccines, we didn't see any signal for myocarditis. It's only when you have adverse event following immunization reporting, which is a well-run system in Ontario, that you find these very rare events. We want to continue to monitor the safety and effectiveness before we make any other recommendations to mandate vaccines in these age groups.
Next question.
From Shalima Maharaj at Global News.
Hi there, Shalima here. Thanks so much for taking my question, Doctor. I did want to go back to the initial point that was made during this conference. And specifically what I'm looking at is the rapid tests in the community. So we talked a lot about schools, and certainly on provincial calls, the number of them that I've been on myself, and we've been told that the transmission is largely happening in the community. So we know the community will be gathering throughout Thanksgiving and many other holidays that are coming up, and then, of course, returning to school. So why focus more on businesses as opposed to the community, especially at a time when we know those intergenerational gatherings, as you talked about earlier, will be happening?
Well, number one, our risk of infection remains relatively low in Ontario as compared to any other jurisdiction in North America. And that's because our system is working. Ontarians are coming forward if they develop symptoms. They are getting tested with the PCR. They are isolating. Our public health is following up with them. The quarantine system's working for contact management. And we remain increasing in our numbers of immunization across the province at 86% and increasing every single day. So to me, the system is working in Ontario. It's not broken. We can refine it with having targeted, rapid antigen testing to stay in school for those that have been exposed in an outbreak or classroom setting, and or for high-risk neighborhoods or schools to have a surveillance system in place. And I do trust over this long weekend, like we had over the long weekend in September, that Ontarians are following the rules. They are limiting the risks. And we did not see, despite Labor Day being a major party event, any significant increase in cases over that time period. So we'll monitor the situation. We'll continue to provide advice to Ontarians. I do believe Ontarians are following the rules. I think they've been brilliant. I want to thank them every single day. I'm so proud of us being able to keep Delta under control, and it's only because they are following the rules. They're coming forward to get tested. 20 to 30,000 people a day getting tested with a very low percent positivity as compared to any other jurisdiction in the country right now. We have a high rate of testing with a low positivity and a population that has embraced prevention through also immunization, but also testing and isolating if they come down with the virus.
Follow-up?
Well, Doctor, you also said earlier that the province is reviewing the best means of implementing an asymptomatic testing strategy, but there is currently a strategy in place. So what is actually being done to date as far as collecting data, making observations, and putting that towards a fulsome strategy? And if you are, in fact, working toward implementing one, when can we actually expect to see that come to fruition?
So there are approvals that have to go through for any program. Those approvals are getting going through the process as we speak. I don't want to get ahead of the Minister of Education as this is under his purview, but I think you'll hear news of both the surveillance strategy and a rapid response outbreak management strategy very soon.
Last question.
From Lorenda Redekop at CBC.
Hi, Doctor. You talked about with the myocarditis and pericarditis. You haven't seen any deaths. The majority of cases are not serious. But what about those ones that are serious? In terms of hospitalizations, what have you seen?
Yeah, so these cases are followed very closely. They're often referred to a heart specialist, and Sick Children also runs a means by which we follow data on those that are 18 and under. We haven't seen any long-term complications. The vast majority resolve very quickly. So to be clear, pericarditis, myocarditis, it would show up with someone having chest pain and or shortness of breath. They may feel a fluttering of their heart. Typically that's within a week of having the second dose more than the first dose. And it's diagnosed through a cardiogram, an electric picture of the heart, and or a blood test. The emerge physicians are very good at diagnosing this, as well as family physicians, and are reporting that to us. So the system of reporting is working. The vast majority have all resolved very quickly. I will point out that the rate is around 2 per 100,000 at a population level of myocarditis, pericarditis, very mild, associated with a vaccine. But with the virus, which actually getting infected with the virus, it's around 11 per 100,000. And those 11 often end up needing hospitalization, and 10 to 20% of those admitted to hospital have some type of inflammation to the heart muscle and or the sac around the heart. And in the intensive care unit setting, it's even much higher than that. So the 11 per 100,000 are typically moderate to severe that occur naturally secondary to COVID-19, whereas the 2 per 100,000 occurring after vaccine are mild, resolve quickly, resolve with simple over-the-counter medications like ibuprofen have not led to any significant prolonged hospitalizations, often a brief hospitalization to get the diagnosis correct and then discharged home. So that's been the typical history in Ontario, and we monitor this data very, very closely. It's reported by physicians or nurses or pharmacists to their local public health agencies, investigated by the local public health agencies, and then collected centrally by Public Health Ontario. We've got a robust system. We've got experience in this, and hence we're one of the first locations in Canada to have this preference on the Pfizer vaccine over Moderna for a very specific age group.
Follow-up, and this is the last question.
You talked about third doses protecting long-term care residents. Another way that some would argue would be kind of a no-brainer for protecting them would be mandating vaccinations for all staff and visitors. Is this something that you have recommended to the ministry, and if not, why not?
We're reviewing that data on a regular basis now, so I believe there's around 93 individuals affected that either work in long-term care facilities and or were residents of long-term care facilities that recently cumulatively have gotten infections. We're looking at that evidence, how it got brought in, whether it was from a non-vaccinated worker or a visitor or some type of break in the infection prevention control. Once we're building that level of evidence, because right now you have a testing strategy and or an immunization strategy. Whether we have to strengthen that is what we're trying to build that evidence base on to make stronger recommendations to protect those vulnerable patients. So we are actively investigating it, and we'll make recommendations to the minister if we find that it's typically in homes with low vaccination rates of workers and or low vaccination rates of patients or clients, and make the appropriate recommendation at that time. But it's under active review.
Thanks, everyone.